Welcome to True Health Tuesdays, and the truth will set you free. Now, today's the introduction to upper extremities. Now, we're going to get deep into detail in carpal tunnel syndrome, golfer's elbow, tennis elbows, all rotator cuff issues, but it's important that you understand the basics. So this is an introduction to the anatomy, physiology, and neurology. Now, number one, most commonly ignored causes, neurogenic. That means compromise to the nerves, and it's going to be in the cervical and upper thoracic spine. Vascular. This means that all the blood vessels that supply that upper extremity come out of the small opening of the thoracic area. So positioning of the head, forward head carriage, lateral deviation are all going to have an effect on this. And mechanical distortions. I mean, when you're just looking at the upper extremity, you've got 18 muscles that guide this shoulder girdle up and down the cage of the thoracic area. And this is commonly missed. Now, when we look nerve roots, and this is going to be dermatomal patterns. That means if you compromise the nerve root, which is right at the exit of the spine, it goes along and affects the area of the hand. So this is the sixth cranial nerve, seventh, eighth, and then you're going to get T1. So the cranial nerves of the brachial plexus comes here. And this is why one of the things when one of the most brilliant doctors, Dr. Jacobson, said to find out what's wrong with somebody, you got to do two things: ask them and then listen. And people will literally tell you, Doc, you got this pain that comes right down up to here. I know exactly where that's coming from. That's the sixth cervical nerve root. So it is kind of exciting that depending on the pain distribution, you're going to identify where the problem is. Now, the brachial plexus, I can still draw this one from memory. It has a nerve root origins right at the spine. And you're going to look that all of these come down underneath the clavicle. So if there's any clavicle issues or thoracic issues, you could imagine that this is going to be significant, can negatively affect the body hugely. So cervical impingement or any type of problem with the neck can alter that brachial plexus. And this supplies the entire upper extremity. So this brachial plexus is not a little important, it is everything. Now, when we look at all the muscles, you've got 7 mobile vertebrae, and to guide the action of this head weighs about 12 to 15 pounds when you're looking at like, say 5 to 7 kilos, 8 kilos, where it's mobile and fantastic. And all of these muscles which are controlled by the nerve. So it's never the muscle, particularly the muscles on the posterior aspect. They're called postural muscles. They're not under conscious control. They increase in tone under position of the spinal structures, as well as your perception of the environment. So when you look at this, normally the ear should be in line with the shoulder. For every 1 inch that heads forward, okay, the pressure on the disc doubles. So that's for every 25 millimeters forward, the pressure on the lower disc double. Now, is the body smart or the body smart? Absolutely, it's smart. So if that heads massively forward, that's going to trigger these muscles behind to do everything it can to pull that head back into alignment. This is why you don't want to just relax the muscles. You got to find out why they're firing. Forward head carriage is not only implicated in a lot of headaches, sinus issues, but you're compromising the blood supply that comes out of that opening to the thoracic area. And you're going to see the rib cage is shaped just like a triangle, just like a pyramid. I mean, it's amazing. That's why you can hold a great weight on your shoulder without crushing the thoracic cage, except that opening is very small. So if that head is forward, you literally can compromise the blood supply and nerve supply. Just look at the details of this. All those nerves go underneath the clavicle. And remember, that clavicle, that's the one bony attachment to hold all the 18 muscles, that entire shoulder girdle up and down. So if there is a lateral deviation or forward head carriage, you can see that this area is extremely open to common whiplash traumas or office work where your head's forward. Now, when you look at normal, the ear is balanced. you're going to see in any kind of trauma, and this could have been falling off a swing when you were 7, can throw that head forward. And the body is going to start to round over the shoulders to open up the holes where the nerves come out, the neuroforamen. And so that rounding over is usually the body adapting. But what are the muscles going to be firing off? Remember, if that head goes forward just 1 inch, just 25 millimeters, the pressure's doubling. So that is going to be causing huge spasms of the shoulders. And I always say it's never the shoulders. You got to find out why. Now, here's a classic patient. Okay, we can see obviously there's some disc crushed inside of the neck. So this person had a significant whiplash trauma. The head is measured. The top of the neck should be over the bottom. So they're 29 millimeters forward. And seeing that there's compression of the disc and distortion of the bone, this person for at least 15 years, could be a lot longer, but it would not have been less, has had forward head carriage, compressing those discs. And what happened? Look at the thoracic deviation. That's the key. When you're understanding that that shoulder has to go up and down, gliding on the thoracic area. And if there is a thoracic deviation, it's obviously going to negatively affect the shoulder. Now, this person had a shoulder replacement, which is really tough because I've never seen a real successful shoulder replacement. There's always going to be limitations in lifting, limitations in movement. Now we are close to Camp Pendleton, so we do have a lot of Marines. 49-year-old Marine, okay, rolled the vehicle, multiple explosions, and he was told that he needs both his shoulders and knees replaced. For some reason, bomb disposal guys in the military typically have shoulders that have been damaged, and I see this all the time. Now look at the center picture, where it says before, but that's this man's shoulder, and we can see that the socket, the red arrow at the top, comparing with the normal, that socket is distorted. And that means that there's been some kind of force loading going up. But now see that extra bony growth? What that is, doctors, if they say it's calcium deposits, that's completely incorrect. This is literally the joint capsule, because every joint in the body is hydraulic. It needs fluid. And if that force loading on that joint is abnormal, then the body is going to turn that capsule or ligament into bone because it's used beyond its design parameters. So this is literally ossification of the joint capsule and destruction of that socket, that labrum, where that shoulder bone, that humerus goes into. Now, before you can see, obviously, there is a reversal with a curve, a negative 3.6 degree curve, and then we got a positive curve in him. But also, remember, bones lay down where it's needed, resorb where it's not. So if you put the shoulder under distractive force loading, and we're going to cover these exercises in detail, but bones can remodel. That you're seeing the bone right here remodeled to a pathologic situation. And it can remodel to a normal situation, but you got to get the blood supply, nerve supply, alter the mechanics, everything. Now, this gal, I absolutely love. Okay, 88-year-old gal. But think of this, 1979, she was in a horrible accident. You can see some bolts in her spine that shifted her off to the side. Now, she did have an amputated leg. And so that means altered mechanics. You can see in the neck, there's a reversal of the curve in the neck. And I just adore her. She was so happy. Because I mean, when you're missing a leg, you've got to use some crutches, you've got to use your arms. And she was actually able to lift her arms over her head. And it I adore my kid patients. I adore my senior patients. But there's such life and vitality and vibrancy. Man, if you can restore nerve supply, you can alter those mechanics. Even with horrible thoracic distortions like this, you can do miracles. So when we talk about the 5 keys to health, and in this series, we're going to cover everything in great detail. Proper nerve supply. Obviously, when you're looking at the upper extremity, you've got to look at the thoracic and cervical spine. If you're not addressing the cervical spine, you're not going to fix the problem. Regular exercise. This means distracted, aerobic, muscular, resistance, okay, every day. Proper nutrition. That means if man makes it, you don't eat it. You know, you've got to have something that your body can break down and utilize. Rest is when the body regenerates. That's why it's so gosh darn important. That's why we have multiple courses on how to achieve deep sleep so your body can regenerate. And then prayer and meditation. Every study, look up every study that involves prayer. Healing occurs faster. It could be because you have a good relationship, you have a responsibility given this body, this beautiful, beautiful body. There's a stewardship to it, and meditation. You're getting that. If you're getting all 5 of these keys to health, you're going to have the best chance of rebuilding healthy tissue. Now, please post your comments below. And within a week, hopefully we'll be able to get to as many questions as we can. And so post your questions right away. Try and share these videos as well. We do have to divide the questions up into what I can speak about on social media and what we can talk about freely on our site. God bless you, my friends. Stay healthy.